Okay, we're back on step 3. Here we are with the lower anterior case with the periodontal situation where we actually had to intentionally remove the lower right central incisor and then reimplant it in position. We've orthodontically somewhat uprighted it and made it even with the right side. Left side he still has a little turn on the left central, but we're going to fill in now the back with rib-on. Before I do that, I want to just trim some of this excess away we did use to tack it in. So I'm going to trim that so we get the best suction only. We want as much, if we can get as close as we can to the tooth with the rib-on, with some material in between the rib-on and his teeth, that'll be great. That's what we want. But the most of the strength is going to come from not only the rib-on but the composite itself. So, all right, now we'll just rinse that off and dry it. Big day for my patient. He just got his teeth cleaned and a couple hours there. Now he's going to spend a couple hours with me here. So we tip our hat to him. He's doing great. And so here we go. We'll do I'm going to go from left to right, and that's how we'll rinse. I'm just going to go ahead and cover. So let's do a count now, 15 seconds. Let me know when the 15 seconds is up. Okay, we'll try to go a little bit interproximal here. Don't forget that part because we might be just filling all that in. Okay, start to rinse on the left side and stay on the left side. Go ahead. Stay on the left side, don't come across. Okay, just come in here, rinse from here, lingually. Hold off for a few more seconds on this side, and now rinse here. Okay, keep rinsing thoroughly. As always, we like to lower the light, but I'm going to do a visual check. Air syringe. And we got a nice chalky surface. That's what you want. We're pre-dipped. Applying the 3M product now. Okay, keep the suction going. Sounds like it's clogged underneath. Okay. Relax your lip. I just want to try a little mylar strip here if we can. 2 pieces. Actually make it metal. I'll take metal. I'll take that light, Paul. Okay. I'm just going to wave this on there right now until we get that ready. Okay, ready? Okay, these are just pre-cut 15 thousandths of an inch. Still in the inch system. Okay, so that's in place. Now I'll cure it. And so we don't invade the bicuspids. We don't need to go any further than just from cuspid to cuspid. Alright. You okay underneath? Okay, great. So the object now is to get enough of the material behind the teeth. Okay, you put about a dot's worth of material. You don't have to overdo it, just enough. Okay, so we're going to do that and then cover it with a black container so it doesn't set on us, and then I've got to go over and treat the rib-on. Okay, so we'll do that now. And I'm going to grab a wedge, a green wedge. Try to put that in a little better position for you. Is that you good? Okay. Need a wedge. Okay. Just want to make sure this stays put. Let's see if one holds it. One looks like it's holding it pretty well. No, we need a larger one. Let's go to the, let me try that purple one. School purple, huh? There we go. That's good. Do another one. There we go. Okay, so that's keeping that in place perfect. Now we can go ahead and we'll use the gold instrument for this. I'm basically going to start just taking some and applying it to a surface. That's it. And we don't have to be too thick here. Have that Hollenbeck. Then we maybe take half of that and just stick it on the adjacent tooth. Now I like Charisma because of the flowability and the polishability and its strength. That in place. And I'm going to use a little unfilled resin. Let me have a new mirror. And a Bendix brush that's dry. I'm going to take that mirror back, Paul, if you can just clean it. That's good. I'll have a little bit that overlaps in the inner prox. More material. Okay, so we're just going to continue to apply it. Just pull it. And grab more material. We try to keep the rib-on up into the incisal third of the tooth. I don't like to see the embrasures clogged at all. Going here. So we're going to add a larger piece here. And much of it's going to squeeze out, and then we'll wrap it around it. Rather have more than less. Here we go. So if we're counting teeth, this is the tooth we just reimplanted. That's number 4. And now we'll do another one. This is 5. number 6. So I got to get more material out now. Okay. I'm going to put a little bit more on this other cuspid. We got the material laid down. But just a little bit more over here. Now we're going to cover this with a black cover.
Okay, stay open for us, alright?
Okay.
Now we're going to come over here. My light's off. I've got a treat now with visor seal. Another unfilled resin. And we're going to impregnate the rib-on material. Can you hold this for me? Give me fresh, please, and a new brush. No problem. I'm going to change gloves. All right. Okay, new material. Okay. So we liberally applied the unfilled resin to this. Just literally paint it on. Keep it wet. Bring it over. Okay. Now it's kind of an estimate. All right, we're in the middle. You can fold it in the middle and you'll know if you've got it right dead smack in the middle. That's right in the middle. Hollenbeck. Okay. Hold on. Okay. So let's just go right here. Have the Hollenbeck. Okay. Mirror. Okay. So there's our position. I'm going to start to adapt it to that. And push it all the way in. And use the tip of your instrument. So I'm using a Hollenbeck right now. I'm pushing it in. You can see what is squishing out around it. So let's see if I can zoom in. Okay. Try to stay open, please. Real, almost done here. Now I'm just keeping the middle pushed in, adapting to the middle teeth first. That's important. Okay, so now we've got to bring it down a little bit. Let's finish this side first. Let's bring it down a little bit, like that. Perfect. Okay, adjust to suction, please. Getting some movement here. Let you stay with the patient, please. Okay. But just raise your hand if you need more suction, okay? We're here to help you. All right? You get a little bit of movement now. We want you to kind of minimize that if you can. You're almost to the finish line. Okay, just adapt that, and then there. Okay, so I'm pushing it in. And I think the key is just to try to push as much as you can in the inner prox, and then you won't have excess. All right. At least try to push as hard as you can to get that all the way in so it touches the tooth. Okay, I'm going to take an Explorer, long Explorer. We'll just go back and forth now. Wipe. Okay, new Explorer. Got it. We're good. We're good. So I'm just pulling up the excess now. Just pulling it up. Getting some movement, okay. You need something to close on, maybe a bike block or something, if we have room back there. Get some suction underneath if you can. Take the Hollenbeck again. You okay? We have a visor seal, please. Okay. Gold instrument. Okay. Okay, my friend, if you can open up just a little bit wider, that'd be great. Thank you. Do you need suction underneath? Okay, we're here to help you. If you need it. You alright? Okay, we're almost done. Looking good. It's just a little attention to detail, but worth its weight. We're almost there. Yeah, I'm like almost to the finish line. Just going over, putting a smooth, textured surface. Beautifully done. Completely covering this material. So it's just beautifully sandwiched in there nicely. Just the right thickness. And this material flows beautifully. Okay, so final thing I'm going to do is just wet my finger a little bit and just kind of run my finger. More material. It's fine. I'm just going to adapt to a little smoothness here. Just gently, barely touching it. Barely touching it. Okay, Explorer. I'm going to adapt it a little bit better. Wet my hand. Looking good, looking good. That side looks good. One more thing, there we go. So what we're going to do now is just do a little bit of embrasure adjusting. So we'll do there, a little bit here. You can do this with a burr, you can just do it now. Make it easy for yourself, just take an Explorer. Okay. One more time with my finger. Mm-hmm. All right. Just taking care of a few more details. Okay, we're ready to cure that. Do a tack wave. And we're going to fill in maybe some of the embrasure spaces in here. Try to give you a final look at this in a little bit. What do we got time? It's about 20 to 12. We're almost lunch hour. We're looking right on time with everything. I think we booked you till 12:30, but I think we're going to finish at 12. All right, so you're looking great. And we started, kind of started at, I don't know, 10:30ish or so, maybe closer to 11 by the time we had the tooth out. So I would say, you know, time-wise is always an issue. I try to predict, you know, 6 teeth, maybe, you know, I don't know. We originally thought maybe 20, 30 minutes per tooth, a half an hour per tooth. So if there's 6 teeth, it's 3 hours. So that's kind of how we formulate the time. Very cost-effective measure. I mean, including the extraction, you're a little over $1,000, but still, considering if you had the alternative, a fixed bridge, you'd be looking at $6,000, $7,000, $8,000. You know, so it's a really good service for patients, and it gives them the ability to use their natural tooth, which is great. And no one knows anything happens, you know, because we kind of come in like a stealth, you know, bomber. You know, we're in there, in and out. We took care of the problem, and he's going to go home, be able to use. Nothing's changed. His bite hasn't changed. The look hasn't changed. In fact, it got better. So he's going to have some spaces in between his teeth from the cleaning, but he realizes how healthy they need to stay. So we'll be doing that at the end again. All right, so we'll pick this up on the next clip. Dr. Jerry Como, take care.